So we have Dr. Kevin Kavanagh with us. He is a retired physician and also founder and president of a national organization called Health Watch USA. Dr. K is what we affectionately call him. Good morning, sir.
Good morning, Jack.
Tell me just a little bit about Health Watch USA, how that came to be and why and so on.
Well, we're a nonprofit patient advocacy organization. We've been around for over a decade. We concentrate on research integrity, but also on patient advocacy. And we're composed of some patients who have been harmed by medical errors, but also by a lot of researchers and professionals who want to see our healthcare improve.
Very good. We start this morning with a question already on our Auto Tech Service text line. You get a bunch of them when you're here. This one says, how much time between the first and second shots?
It depends on which shot you get. Usually Moderna, they will want to have 4 weeks, and Pfizer 3 weeks, or it may be reversed. I always get that mixed up, so don't hold me on that.
You're right.
Yeah.
Because I just got the Pfizer and it was 3 weeks. Yeah.
3 weeks. Okay. So, it does take a little bit of time, but not a lot. And then, of course, 2 weeks after that, you need to wait before you get immunity.
And then also, if you happen to get the Johnson & Johnson product, it's a one-shot deal.
One-shot deal, yes. And remember, that product was tested on more virulent type of variants. It was even tested in South Africa. So it may actually be the preferred shot. You cannot compare that vaccination with the ones previously because they were tested in a different time period on different really types and variants of the virus. So they're not directly comparable. Johnson & Johnson is a good one to get. Which one you should get? Whichever one you can and available. Very important to get vaccinated.
First thing this morning, CMS relaxes nursing home guidelines. I don't want to put you on the spot. What does that stand for? Do you know, CMS?
CMS, that's Medicare. That's essentially the insurance company arm of the government, and we are very concerned about this relaxation. We do not feel it is very wise on how they've laid this out. CDC did not announce this, which to us brings up some red flags. And there are a number of things in the relaxation that are problematic. One is that they have a safety benchmark of a community being less than 10% of the tests being positive for COVID-19. Well, that's way too high. There's other things in this explanation that they have which also kind of raises our concerns, such as that people can walk into a facility who haven't been vaccinated. If there's an outbreak in the facility, they secure that into one area of the facility. And that probably won't work because of aerosolization. They assume the virus won't spread or aerosolize from one area to another. They assumed that if you had 70% of the people vaccinated in a facility, that you'd have herd immunity or something in the facility. Well, that's a community measure. If you've got a facility, the virus just spreads. It's indoors, poor air circulation. The virus aerosolizes. I just don't think it's wise at this point. Dr. Fauci was on CBS News last night, and I've got sources quoting him saying that he wouldn't feel comfortable relaxing public health standards until our nation's cases fell below 10,000 cases per day. And I think that that is a very important concept. So the important thing is, if you're worried about all this, is just get vaccinated. Because obviously if the resident's vaccinated, the visitor's vaccinated, you've got a high degree of safety at that point. So please get vaccinated.
This is still going to be the decision of the individual nursing home. I mean, they don't have to open up because the CMS said they could, right?
That's correct. That's correct. And I would certainly wait.
Set their own standards, in other words.
Yes. And I would wait at least to get clear guidance from the CDC. So I do think what the governor's recommended of wearing masks if you're not vaccinated and you're getting into the nursing home, making sure you social distance, don't hug a person unless you're vaccinated. That is key. But to me, if you're spreading the virus and you walk into that nursing home and the virus is aerosolized, you have the potential of infecting others. So the bottom line is get vaccinated. Then it removes the whole thing as a problem. So I'm concerned.
Now we're going to go to our Auto Tech Service text line where we have several. Bill wants to know, would 2 doses of J&J increase efficacy?
Well, they're studying that, but they don't know. One of the things with the J&J vaccine is that it's made with an adenovirus. And the adenovirus heightens your immune response to the stuff inside the capsule that it's delivering, which is the DNA, which makes the RNA, which makes the spike protein. But at any rate, that adenovirus does elicit immune response. So one of the scenarios is that if you get a second dose, you may react to that vaccine, killing the vaccine as it comes in, and it doesn't really get a chance to do its job. Interestingly, the Russian vaccine, which they have 2 doses, uses 2 different adenoviruses. So they kind of get around that problem. So they're really not sure. That may happen, it may not happen, but that's why they're testing it right now in trials to see if they can get a better immunological response from giving that second dose with the J&J vaccine. But just don't go out and try to get a second dose.
Well, Bill sent a second question that if later this year J&J is available and had one of the other, if you had one of the earlier shots, I guess one of the other vaccines earlier in the year, should they get that? And I'm assuming you're saying no, you don't need it if you've had 2 of the other products.
Yeah, if you had the other products and you've had 2 of them, I certainly would not get the J&J vaccine, because remember, there's probably going to be a booster out for the South African and Brazilian variants, and you're going to want to get that later in the year. So I wouldn't do that. I'd stay on track on the course that you're on.
Here's another text from our Auto Tech Service text line. Does Dr. K know how long the immunity from the vaccination is thought to last? That's from Barb.
No one really knows that. It's hoping it will last at least a year. Of course, as we go along, we get more and more data. We know it lasts at least 3 months, but I suspect it's going to last a year or more. But I do not think it's going to last forever, because this is a coronavirus. It's not going to be like a measles vaccination. You're going to have to get another shot at some point, and you'll probably get one that will also incorporate the genome of the spike protein of the new variant that's up and around. So I would plan for a shot every year or every other year.
Now, Dr. Kavanagh, AstraZeneca, which is not used in this country but is in Europe, and there's some problem with it. Is that right?
Well, yes, and this vaccine has been problematic from the get-go. As you can remember, we had previous reports that it may not be that effective with the South African variant, and its usage was suspended in countries at that time. That vaccine is made entirely differently. It again uses a virus to encapsulate DNA, but that virus is actually a monkey type of a virus, and it elicits a large immunogenic response, but one that may be too large or affects people adversely when this new report is really interpreted, that it may cause blood clots and other complications in people. Now, that's not very common to happen, but it's common enough that why not use the other vaccines that don't have that problem? So it's becoming, I think, the stepchild. It's still effective. Overall, it's still relatively safe, but not as effective and maybe not as safe as your other alternatives. So I think it's going to go by the wayside.
It hadn't been approved by the FDA. It's not going to be here probably ever.
No, it's not going to be used in the United States at this point. I would be very, very surprised if it was.
All right. Now, I understand there's a new study that says that cotton masks may work well, especially in high humidity environments. Tell me about that.
Yes, they have found that with heavy breathing or in high humidity environments, you may get up to a 33% improvement in filtration. And at that point, they may even be better than other types of cloth masks. Now, we're not talking about better than N95s or KN95s or a true surgical mask. We're just talking about the best type of homemade mask you could have. And of course, cloth masks should be multiple layer, 3 or more is best, tightly woven material, which is tight fitted to your face. So that's, I think, kind of good news. Another way that these masks can actually be effective in filtering out the viruses. And we are worried about aerosolized particles, so fit is very important.
All right. As we continue here, another text from our Auto Tech Service text line. If you have received both doses of one of the vaccines, what is the latest on being a carrier and the possibility of spreading the virus to non-vaccinated people? That's from Amy.
Well, they do not know for sure if you can become a carrier, but the studies which are coming out look more and more like you will not be, or you will be a carrier for a very small period of time. So they are starting to relax restrictions on people that have been fully vaccinated. For example, if you are exposed to someone with COVID-19 and you are 2 weeks out from having your second dose, and you've had that dose within a 3-month period, CDC says you don't have to quarantine. But of course, you should still be wearing a mask and social distancing. So they are starting to relax restrictions on that. And I should add that as time goes on, we'll be getting more and more information. But right now, the laboratory data and the case reports look good that the vaccine will protect you from asymptomatic carriage.
All right, let's go back to the phones. Rick, good morning. Rick, you're on with Dr. K.
Hey, good morning. Good morning, Catfish. How are you? Long time.
Good, thank you.
Dr. Kevin, you may have already answered this. I just tuned in the program. We're going to Indiana and maybe Michigan tomorrow. Wear masks, and do we quarantine when we get back, or?
Well, ideally, it would be good to be vaccinated. Right now, CDC is still suggesting don't go traveling, and they're more worried about people spreading around these variants. So if you've got to go travel, yes, wear a mask, social distance. If you get back, whether or not you quarantine, I think you're going to have to check with the health department on that. It would depend upon what types of settings you were going into and who you were gathering with. I mean, if you're going out for a doctor's visit, probably not, but you've got to be careful.
Can I do one more question, Jack?
Yeah, sure.
Real short. When you get the vaccine, I'm scheduled to get mine next Wednesday. When you get does that vaccine get in your bloodstream or just stay in where they shoot it in your arm, into your muscle or whatever?
Well, the vaccine itself stays just in your arm. In other words, the mRNA, or if you get a DNA one, that makes mRNA in the cells. And that's just in your arm. But the reaction which occurs will then spread throughout your body. I mean, your cells which become immune in your arm are blood type cells. They tend to float around everywhere. And of course, antibodies float around everywhere. So the vaccine itself is in your arm, but the reaction is systemic, or it's everywhere.
In your bloodstream and blah, blah.
Yeah, and in your bloodstream. Now, the big question is it inside the nose, which is the IgA antibodies? And that's why people are worried that they still could be an asymptomatic carrier. As I said before, good data, it kills the virus dead when it gets into your bloodstream. Data is just coming out about how effective it is killing the virus replication in the lining of the nose. And right now, it looks promising.
Before we run out of time, one more thing. Brazil plunging into a crisis, right, for a second wave?
Yes, and that's why people are very, very concerned about relaxing public health measures, is because of the Brazilian and the South African variants. Those two are very similar. These are more infectious, they're more deadly. And obviously, if you have a third of your population vaccinated, which we don't even have fully vaccinated yet, and you have a virus that is twice as infectious, twice as deadly, you haven't accomplished much at that point. So yes, follow public health advice. It's not time to relax restrictions. We're almost there. We're vaccinating so many people every day. We are almost there. Let's just hold our course.
Yeah, that's really, really good advice. And I hate to hear that about Brazil because, gosh, they had such a horrible, when it first came out, it was just, I remember seeing the visions on TV of the graves and all the people dying there.
Jack, same thing is happening in Europe. They're starting to have a resurgence. So we need to look at what's happening elsewhere. Oh, yes.
I totally agree with you. I think we're lightening up too early, too soon. Give us 20 seconds. We're just about out of time.
Well, for everyone, please get online, get some good masks, KN95s, N95s. Make sure your masks are well fitted and respect others and respect business owners, and please follow their advice and guidance.
Have a good weekend. Thank you.
Thank you, sir.